The Democratic News Conference today. Senator, good afternoon.
Good afternoon, Thomas.
Tell us all a little bit more about the impact that the Blunt Amendment would have on women's health care in this country.
The Blunt Amendment is a radical amendment. It would not only take away the ability of women to get contraception through their insurance, but it would threaten every single essential health care service, every single preventive health care service, if your employer or your insurance company had a moral objection. So let's say you work for someone who believes prayer is the answer to all diseases. You wouldn't have any insurance. It is a radical departure from what we've always done in this country, which is to give a conscience clause exemption to religious institutions and religious affiliated institutions, but not allow someone to say, for example, you know, I think if somebody is overweight and they get a heart attack, that's their problem, and I have a moral objection, therefore, to making sure that they can get health care after a heart attack. This is how radical the Blunt Amendment is. But here's the thing I want America to understand. We are on a highway bill, a transportation bill, a bill that has come out of 4 committees with strong bipartisan support. 2.8 million jobs are at stake. There are so many construction workers out of work because of the housing downturn. We want to put them back to work. And what's the first amendment the Republicans put up? A contraception amendment, which they say is about religious freedom, which has nothing to do with it because President Obama has taken care of that in a grand compromise, which Catholic Charities supports and the Catholic Health Organization support and Catholics United support. So that's taken care of. They're just radical, and they're going after women's health. That's the truth.
Obviously, the conversation is off track when you talk about the promising conversations, the bipartisan support for the highway bill that you mentioned. Senator Murray, though, is promising failure for the Blunt Amendment coming up tomorrow. I just also want to let everybody know that in Virginia, the governor there, where they watered down its ultrasound bill, there was even a House hearing on that mandate yesterday that featured 3 women, one of whom was for the mandate. Do you think that this conversation is one for the win column yet?
The conversation on going after birth control, or which conversation? Or forcing women to undergo procedures that are not medically necessary and taking that away from them and their doctors. Are you asking me if this attack on women's health care is going to continue? Is that the question?
Basically, is this attack on women's health care going to continue? Is this conversation not going to be thwarted by a unification of political women leaders on the right and the left? Basically, as you're saying, you want to get the conversation back on track to important measures like the bipartisan support for the highway bill. So why is Washington so distracted, and states like Virginia so distracted by this conversation?
Because all you have to do, for example, is look at the Republican presidential election. The Republicans are caught up in this right-wing ideology, and they can't stop themselves. Honestly, until women just get their attention, as they did in Virginia, where they backed off of actually mandating an invasive procedure. They finally had to back off of that. Some politician there said, well, his wife threatened him that she'd never talk to him again or something if he did this. The fact of the matter is, these Republicans can't help themselves. They've turned into a right-wing party. It's fanatical. It's turning on the women of this country. When you have Senator Snowe saying what she did, and she is a moderate Republican, the last of a wonderful breed of people that I've worked with for many years on many issues, saying that these polarizing issues have no place in these debates, she's absolutely right. And by the way, today she came out against the Blunt Amendment, and I'm so happy about that.
Senator, while you can respect the colleague that Senator Snowe has been to you, do you look at this as an opportunity for the Democratic Party?
Well, electorally, absolutely, because the outside of Senator Snowe, the other Republicans, as I understand it, who are running, represent that right wing that's declared war on women's health, war on workers' rights, war on the environment, and I think we Democrats there have a very good chance because it is quite a good Democratic state. But, you know, the most important thing for the people there, they're not partisan. You know, they want to know, are you going to fight for our families? Are you going to fight for our children? Are you going to stand up for the 99%? Are you going to protect our rights? And I think in the case of that election, without Senator Snowe in there, we should pick up that seat. It's always a fight, but I think we should.
Senator Barbara Boxer, always nice to have you on. Thanks for making time for us. I appreciate it.
It's always a pleasure.
Next up, the president